Well, there's a wealth of information about breast cancer out there, which can be extremely helpful, but also overwhelming. The management plan you choose to take should be informed by three overarching factors: family history, personal history, and your genes. Chief Medical Officer at Invitae, Dr. Robert Nussbaum, joins us with an overview on how to assess risk for breast cancer. Doctor, can you tell us how people can assess their risk for breast cancer?
Well, the three factors you describe are key. One is your own personal medical history, because certain patterns of cancers would suggest the possibility of a hereditary form. Second is family history. Knowing your family history is extremely important. Who is affected with cancer in your family? How are they related to you? What kinds of cancers were they? But third is genetic testing, which is to find out whether you have a defective copy of any of the genes that increase the risk for breast cancer.
What is genetic testing and how is it effective in gathering these necessary insights?
So, first of all, there are certain kinds of therapies that are most useful and appropriate for patients who have a defect in one of these genes. So, it's a form of precision therapy. The tumors are particularly susceptible and vulnerable to certain kinds of treatments when there's a defective BRCA1 or 2 gene or some of the other genes related to it. But furthermore, if you have a change in one of these genes, it will alert your doctor that you're at risk for other cancers. For example, the breast cancer patient may also be at risk for ovarian cancer or pancreatic cancer. And then finally, there's the family who needs to be considered. Are there other members of the family who carry the same change in the gene? And are they at risk? And that includes men and women, because men who carry changes in these genes have an increased risk for prostate cancer. So the management is profoundly affected by knowing whether there's a genetic change.
Doctor, where can people go for more information?
Well, they can certainly go to our website, invitae.com, invitae.com, but they should also talk to their healthcare providers, who will either discuss this with them or refer them to a genetic specialist or genetic counselor who can discuss genetic testing with them.
Well, thank you so much for joining us and for this very important information. We'll be back with more Life Love Shopping right after this.